Surgeons of Reddit, what was your oh shit moment? Doing a C-section for this poor mom who'd been in labor for hours. Baby wouldn't come out of the hole we'd made, so more pressure was applied to the fundus, top of the uterus, and suddenly whoosh, baby zooms out like a torpedo, covered in lubricating vernix, zips over the surgical sheeting which has the texture of a slip and slide and almost rockets straight off the table. The baby's foot was caught by the reg who whipped her up in the air upside down like in old cartoons, but almost dropped her again due to gloves plus vernix. Thankfully the midwife was ready with the towel and caught the baby to wrap her up. Mom and Dad seemed to think this was normal practice and didn't notice, but me and my colleague just stared at each other with a look of absolute horror. It still makes me shudder to think how close the baby was to hitting the floor head first. Never happened before or since. Doctors were very accommodating and even had a baby juggling routine to put new mothers at ease. 5 stars, would give birth again. I was doing a corneal transplant when I had the oh shit moment. During surgery, I cut off the patient's own cornea and replaced it with a new donor cornea. During that moment when the host cornea was off but before I could get the new one on, there's literally nothing on the front of the eye except a tear film and aqueous humor. Anyway, the patient takes that moment to start vomiting. The reason we tell everyone to skip food and drink is so they don't aspirate in case they throw up. This patient lied about eating breakfast and started throwing up everything. The eye is still, open sky, at this time. Everything inside of the eye can now become outside of the eye. And she's bucking and vomiting. Those not in the know will say this is not good. Those really in the know will say oh shit. Anyway, I had to grab the new cornea and start stitching as fast as I could on a patient actively throwing up. I used 10-0 nylon sutures which are thinner than an eyelash. It turned out okay but not great. Don't lie about eating breakfast before surgery, folks. I worked at an ASC for years and it's unreal how many patients come in with full stomachs. I think they need to be made aware of the horrors of eating before surgery. Whenever I'm going under, I fast for 12 hours at the least to make sure every single thing has processed and left me. I'm terrified of these anesthesia scenarios. I think it's because most people are just told not to do it but never why they shouldn't do it. We had a family bring in a child with a stomachache. They had stopped for fast food on their way to the ER to see if it would make her feel better. Except they said she had not eaten for hours and she had appendicitis. She aspirated, nearly died, and spent months in the PICU. Do not lie about eating before surgery, kids. Happened at my hospital. A mentally ill young woman, who was pregnant at the time, was in denial, locked herself into her room when she realized the contractions were coming. She basically didn't push and the baby didn't come naturally. Her family called 911 because of the smell. The ER realized her baby had died inside her due to the rotten smell. She was taken to the OR to remove the baby and apparently all the nurses and surgeons were vomiting because once they opened her up the smell was overpowering and it was traumatizing to see that. Edit, not a surgeon. I'm a hospitalist physician. When I was a new RN working the ICU in a large teaching hospital, I came into work one morning to a patient that was admitted that night, intubated, breathing tube in, sedated, Foley catheter, tube in PP hole, and all. Long story short, he was extubated, breathing tube out, that same shift and was completely alert and oriented. He was an end-stage renal patient, meaning his kidneys didn't work and he needed dialysis, and was only in his late 30s. Said he never made urine anymore and didn't need the Foley catheter, so he wanted it out because it was hurting. Now the catheter bag had been empty my whole shift, which is normal seeing as how he didn't make urine anymore, and this hospital had a nurse-driven Foley removal policy, meaning while we needed a doctor's order to insert one, we could remove one at our discretion, unless a DR specifically put in orders not to. This patient had no such DR order, so I went to remove the catheter. They are held in the bladder by a balloon on the end that is inflated with 10 milliliters of saline. I de-inflated the balloon, removing 10 milliliters of saline, and pulled it out. As soon as the catheter left his penis, blood started pouring out in a heavy stream. Turns out the nurse who placed it on admission hadn't advanced it far enough since there was no urine production to indicate correct placement, and had inflated the balloon while still in his urethra, causing trauma. It would not stop bleeding. I had to hold this man's penis shut to put pressure on it while my coworker paged the resident who came and looked at me with pity as he told me to just keep holding this 30-something-year-old man's penis in my hands to staunch the blood flow until urology could get there to assess. It just kept gushing blood every time I eased up to check. For over an hour total I held this man's penis and tried to make polite conversation until the urologist arrived. Surgeon here. I've dealt with loads of morbid stuff, but one thing that made me stop and go, oh shit, was a conversation with a young patient who had a perforated colon from diverticular disease, which is a common wear and tear of the colon. He was one of youngest patients I had seen with this condition, and certainly the youngest with a perforation so bad as to require an operation. When I was counseling him on the operation, which involves removing the perforated part of the colon and giving him a colostomy, he told me his biggest concern was how he was going to have anal sex with his same-sex partner. He would only have a small stump of rectum left inside, which would be at risk of perforation with any force applied to it. It made me really think about the implications of the surgery we do. The operation is the easy part. I'm not a surgeon, but when I was in med school there was an oh shit moment for everyone, including the surgeons, anesthetists, nurses, and students. They were prepping a patient for surgery and put him under, and the nurse said, "Okay, he's out," before they were about to start slicing him open. The patient just had enough strength to move his head from side to side and said, "No, I'm not out yet." Everyone laughed it off, but if the patient didn't do that, it could have ended badly. This is one of my worst fears. Not being out, just immobilized and undergoing surgery due to a bad anesthesiologist. Not even sure if that could really happen, but I don't like thinking about it. Happened to my mother when she had a C-section while giving birth to my brother. In those days they would knock you out for C-sections, but use as little anesthetic as possible to protect the baby. They gave her enough that she couldn't move, but she was still awake and felt everything. She was pretty traumatized. Not a surgeon, thought I'd share this though. Husband went in for a routine colonoscopy, and as they were prepping him, anesthetist asks him if he's a ginger. My husband tells him yeah. When he was a kid growing up, he had fire engine red hair, though it's faded to a more strawberry blonde now. The anesthetist laughs and says, "Okay, I gotcha, we'll give you the redhead dosage," and winks. Well, my husband thinks it's a funny, until he wakes up at the tail end of the procedure, pun intended, and doctors are just chatting it up and what have you. Turns out it's not a joke, and redheads have some type of natural block to anesthesia. Dude had given him max allowable dosage, and he still woke up. Happened a couple years later. They gave him ketamine and some other shit to knock him out to get wisdom teeth out when he told dentist about the colonoscopy thing. He still woke up at the end of that one too. The red hair is a mutation. The location of the mutation also impacts the opioid receptor gene. I was the patient. I had a liver transplant and was having an ERCP done to place a new bile duct stent. Well, apparently my anatomy is different than normal, and my lungs go more down my sides. So he accidentally caused a nick, which caused a hemothorax. So when I woke up I couldn't breathe. They did an X-ray and had to do a chest tube. Eventually I was so exhausted I asked to be vented, so he vented me. Apparently he cried, he felt so bad about it all. But it wasn't him being malicious or negligent, it was simply an accident. Sometimes things happen. You can be the best in the world and still make a mistake. Exactly. It wasn't fun, considering it was supposed to be an outpatient procedure that turned into a 2-week hospital stay with 3 chest tubes and a couple weird med reactions. Couple of those days were ICU as well. Not me, but my uncle, he's a respirologist, and was supervising sitting in on lung surgery to remove a tumor. Turns out the tumor was a root ball. Some type of seed had gotten into the patient's lungs and started to grow. I had an ingrown toenail. It was supposed to be a quick fix. I was 14 and had my mom with me. They let an apprentice do the surgery and he goes, "Oh shit." The doctor in charge just laughed and said, "No risk, no fun." Turns out they fucked up my toe and I had to have 4 more surgeries to correct it. I cried. My grandfather told a story about a clamp coming off an artery while he was pulling a kidney in rural Wyoming in the early 50s. The abdominal cavity was quickly filling with blood and the nurse fainted. He was able to push down with his elbow on the descending aorta and got the clamp back on. Patient lived, but I think he chose his surgical assistants a little more carefully after that. Do you have a similar story? Leave a comment and subscribe to the channel if you want to see more videos like this one.